Thank you. Good afternoon. Auntie Juka, that was very kind. I feel like I'm at home because I'm sitting around dads, moms, people that educated me or educated people in my family. So it's really an honor. So I always wanted to start this event by expressing gratitude to you guys. I think it's quite interesting because we are in a very particular point in time in Gambia, but also in Africa, because these are the people who built our nation. So even though we've left Gambia at some point and become beacons of hope or shining stars in the Western world, a lot of people don't know the anti-Satans of the world. A lot of people don't know the anti-Jukas of the world, who gave us to the world. They left us with our cups full of knowledge and wisdom. So it's really an honor to talk today to you guys about healthcare. Yes, it's the University of Senior Citizens, but healthcare is ageless. But I wanted to make an observation in the room. Before the event started, I knew my aunts and my moms will outnumber my uncles and my grandfathers. There's two things to notice about that. One, my uncles and my granddads are not living long enough. But also, most men only have a relationship with healthcare in a time of crisis and emergency. So I may see them when something's already wrong, but traditionally, the women in our society, the women in Africa, have been shepherds of not only their health, but the health and well-being of the nation. So this is very standard in terms of representation. But nonetheless, as long as you provide information to one motivated individual, Gambia is also a sense of community. So my main goal at the end of this lecture is to at least equip you guys with some information that could be dinner table conversations. Auntie Jainaba mentioned something quite interesting. Gambia has one of the lowest populations of 65 and above in the world. Our ranking is 187 out of 196. And we're only 2.5 million people. So as Auntie J rightly mentioned, only 2.4% of our population are considered older persons, seniors. If you take a microscope and zoom in closer, only 0.1% of our population lives to celebrate 80 years old. It gets smaller. What I see is only 2.4% of our population who has the opportunity to pass down wisdom after decades of serving their country. What I see is only 2.4% of our population who get to meet their grandchildren and tell them stories that will remind them of who they are. So oftentimes we talk about healthcare from a medical perspective, but it's the human experience that is robbing us of. Japan has a population of 125 million people. 30% of their population is above 65 years old, meaning 37 million seniors live in Japan, meaning there's 10 times more seniors in Japan than there are humans in Gambia. And on the flip side, our median age as a nation is 16 years old. So you have a dwindling population of our seniors that really need to be preserved, while we have a booming population of young people. So even if you see a lot of things in our society sometimes that we question, the ratio is off. We don't have enough seniors who are living long enough. And traditionally, men die early but marry young. So Gambia also has one of the highest rates of widows who haven't celebrated 50 years old. So this conversation about healthcare, hopefully this is a primer to let you guys know I could talk about the medical stuff, which I would, but it's linking our human experience around healthcare, particularly about people that to me are the most valuable aspect of our society, that we're losing at a rate too far. Healthcare is also interesting because as scientifically, the moment you're born, you're a miracle. Mathematically and scientifically, you're a miracle because so many things could go wrong. But the moment you're born, you also start dying as a human being. So nobody's healthcare could be better as you age than it was as you were young, which is why even infants have a more resilient immune system because God typically gives them the protection they need so that they could have a chance of survival, which is also the reason why young children, women, babies are more resilient than male babies. Because without that evolution, and God is a beautiful God, the human race will be at risk. If more women were dying faster than men, the human race will have less likelihood to keep propagating. We'll be extinct. We'll be extinct. So our bodies are a very interesting thing when it comes to healthcare. And I always use myself as an example. A huge factor that we don't talk about in our community is genetic predisposition. Most of us, the moment we're born, by virtue of who our father was and who our mother was, we either have a higher chance of living a long life or a lower chance of living a long life because of genetic factors. And even in my household, I tease my dad because he's in his 70s, but his blood pressure is better than my blood pressure. He's been a smoker his whole life. His cholesterol level is better than my cholesterol level. But if you look on my mom's side, traditionally, they don't live to be 60 years old. My grandmother, Aja Fatim Menga of Afdai, died when she was 56 from diabetes, hypertension. So a lot of people, when they ask, why did you think it was urgent for you to come home? Practicing in the USA gave me a perspective because so many of my patients were in their 80s, in their 90s, in their 70s, and their quality of life always made me wonder, why did I not get to know my grandmother? It's not normal for somebody to, God has its way of dictating our lives. But from a scientific standpoint, there's something flawed in the idea of somebody who has a chronic condition passing away at 56 years old. So when people ask my why, or the why for Africa is, we have an opportunity to change the conversation about healthcare. And especially for people who, as they get older, life also has a way of bringing healthcare to the forefront now. Which is why I'll tease my uncles again. Because they say most men, especially in Africa, they spend their whole lives chasing money and status in society. To get old and spend all their money and status in society chasing their health. So in retirement, instead of spending time with their grandchildren, instead of investing to create generational wealth, they have had health ailments that has been festering for decades. So their quality of life in retirement, and you guys, most of you guys are retired as in Senjara Mawachana. This is a time where us, your children, give back to you guys. But oftentimes, a lot of people don't live to smell the roses, and they've planted seeds over decades, yet they don't get to smell the roses. but it's our relationship with healthcare. I want to explain something because I'm a pharmacist by profession. And what that means is most of the times people don't understand the clinical process. And I wanted just to touch a little bit on how healthcare works. If you think about a funnel, right? The moment you're born, you're dumped in the top of the funnel, as in you're considered healthy. At the bottom of the funnel is you passing away. So think about your life as a funnel. Every single person is going to transition through that funnel at different rates based on different factors. So healthcare at the top is healthy individuals, which that group of people, you need to get preventative healthcare. You need to have family conversations to know if mom has diabetes, diabetes is in me. If mom has hypertension, diabetes is in me. If mom has diabetes, dad has diabetes, diabetes is definitely in me, genetically. So you start playing defense against something that you know is coming. And I use my family for example because my wife, there's diabetes on her side of the family, and there's diabetes on my side of the family. So my daughter now is being trained knowing that she is going to come across with diabetes at the age of 4. But you start transitioning down the funnel. And the lower you get in the funnel, the more expensive healthcare gets. The reason why oftentimes we say healthcare is expensive only in a time of crisis and emergency, which is what healthcare system we have, unfortunately. We have an emergency care system. We have a system that you seek care when something's wrong. We have a system where you seek care when your kidneys are already failing. But the failure didn't happen now. You had hypertension 20 years ago, but did not know. We have an emergency care system where you present to the hospital with a diabetic coma. But diabetes has been in you since you were 25, but you did not know. So we spend a lot of resources handling bottom of the funnel healthcare problems, when even people in the middle who have a chronic condition, you could keep them in the middle for as long as possible by using some healthcare metrics that I'll talk about. So my perspective as a pharmacist, I've always been at the position where being in a community, I know more about what happens than most other healthcare professionals, because what a prescription is a solution. Meaning as a patient, typically, when you present with something that you feel is not wrong, from a healthcare standpoint, we call that a subjective assessment. Subjective as in Auntie J's knee pain is different from my knee pain, but you cannot measure it. Subjective as in if I wake up feeling down and sad, and Auntie Juka wakes up feeling down and sad, you cannot measure it. So it's the most inefficient way of measuring healthcare, but it's the beginning because that's what takes a lot of people to seek healthcare. That's where everybody's healthcare journey starts. You wake up in the morning, you know something doesn't feel right, but you can't measure it. So when you present into a health system, the first line is taking subjective and trying to find an objective measure. As in, let me check your blood pressure, because blood pressure is not subjective. You know if it's not 120/80, there's something going on. Let me check your blood sugar, because it's objective. If your blood sugar is 200, it's too high. So you take the subjective and the objective, and the physician uses that information to pinpoint what they think is right based on the most information that they have readily available. Which is why diagnostics, all it is providing a physician with as much objective data point, something that is not a lie. Numbers don't lie. So that they could take it with your subjective assessment that you tell them, family history on a scale of 1 to 10, how much does it hurt? How much is it affecting your ADL, activities of daily living? You're not able to pray. You're not able to take a shower. And they find out what's wrong as in a diagnosis. But the physician still has to write a solution. And it comes to us. So even in the USA, 40% of the prescriptions that a physician writes never gets filled in the pharmacy. So think about, you've gone to the best doctor in the world, you've gone to the best lab in the world. He says you have hypertension. And all you need is one medication pill that you take 8 o'clock every single morning, and it makes your blood pressure that of a normal person. So meaning your entire fate from a healthcare standpoint and that condition revolves around one pill. So use that and juxtapose it in our communities now. That's why the best way, when we were building even healthcare, I always felt like if you cannot guarantee that somebody has the right medication at the right time for an ailment that you cannot manage without medication, every single thing before that is futile. There's a famous doctor in the USA called Dr. Peter Attia. He has a concept of the Four Horsemen. If you take infectious disease and accidents and put it in one bucket, people used to die in the numbers because of infectious disease. Afdai is Afdai because of an infectious disease. Polio used to ravage society. Smallpox used to wipe out. So science has gotten to a point where infectious disease is not killing as many people as it used to. Unless antibiotic resistance happens, because we're also over-consuming antibiotic, and accidents. Car accidents, Gambia is a huge problem. So most people will lose their lives because of those two things. But if you think about the 4 main reasons why most people die early, they call them the Four Horsemen. Cardiovascular disease, issues of the heart. That means heart disease, too much cholesterol that clogs your heart failure, cardiovascular disease. That's one. Number 2 is metabolic diseases. Metabolic diseases meaning what you put in your body has lost the ability to process it the right way. That's all diabetes is. Your body has lost the ability to effectively manage the amount of sugar that you put in your body. Because sugar is a new invention. The early days, sugar was not available. The Industrial Revolution, the sugarcane plantations made sugar so abundant that genetically we're not used to processing the amount of sugar that we have available to us. But also sugar is the most addictive drug in the world. And when you say sugar, a lot of people think sugar that you put in. But carbohydrates in general. Rice is sugar. Bread is sugar. It's all glucose. The only difference is how fast does your body process it when you put it in. So metabolic conditions, hypertension, diabetes, meaning something is not working. So if you look at most of the deaths, cardiovascular, horseman number 1, metabolic conditions, horseman number 2. Number 3 is neurodegenerative diseases. Those are things like Alzheimer's, Parkinson's, things that affects the nervous system. It especially as we age, we have a higher predisposition to them. And then horseman number 4 is cancer. If you look around, most people that have lost a loved one, you could pinpoint it to one of those horsemen that caused the early death. And those horsemen, the only way to play defense is early detection and prevention. So even if you look at healthcare, especially as we age, the earlier you start educating yourself about the Four Horsemen, the earlier you start doing family history to find out what is the cause of this early mortality, you're more equipped with information. Maybe cancer, there's still a lot of research that has to happen. But diabetes, hypertension, heart disease are not death sentences. They're metabolic conditions that the sooner you find out, they're remedies to slow down the progression. It won't go away. And oftentimes we have a lot of denial in our society because we see it in our facilities. You tell them, I think you're hypertensive. Not even I think, I know you're hypertensive. I know you're diabetes. You know, bama weru si lumay nani da ki muna daf defa gara febar suku. As in subjective analysis. But when they have a diabetic coma, they stay away from the tradition, and tradition is not all bad, but they stay away from alternative treatments and now run to the established medical institutions praying for a miracle. And when they get there the next day, they'll call people like Flex Dan, the Aswing health system be done about it. When 20 years ago, it would have cost them no money to check their blood pressure and start treatment. That's why I never mention how bad our health system is. Because Gambia, we don't need a health system that they sell us. If the average age of the Gambian is 16, who are you building a 500-bed hospital for? How many 16-year-olds that if you take away infectious disease and accidents need a hospital bed? Not a lot. What our health system needs is trying to make our entire population identify where in the funnel of life are you now, and how could we slow down how fast you get to the bottom of the funnel. What that means is knowing your numbers, checking your blood pressure, checking your blood sugar, using diet and exercise, which is sometimes more potent of a solution than medications. So we have to reimagine healthcare, especially in our senior community, because some of you guys in the room, you've been blessed genetically. You won the lottery genetically, because there's no risk of cardiovascular disease in your family. There's no risk of metabolic conditions in your family. When you could have people as young as me, since 28 years old, I've been taking medications for hypertension. Since I was 28. But the moment I found out, I thank God. Because I was like, out of all my siblings, I am the most prepared and equipped to manage this. So it was never fair. What we should be afraid of is what we don't know from a healthcare standpoint. What you don't know is the most dangerous. More the better. What you don't know. But what you know, in this modern day and age, there is so much technology and advancements in medicine that the sooner you know, the longer you could extend your life. So it becomes a conversation of not quantity of life, but quality of life. That's the true measure of wellness, health span. And oftentimes health span, they categorize it into three components, especially as we get older. Cognitive. How is your memory? If you enjoyed writing, are you still writing? If you enjoyed chess, are you still playing chess? If you enjoy telling stories to your children, are you still enjoying it? The brain is a powerful machine. That's why even in retirement, the one faculty you don't want to retire is your brain. Because the sooner you start using it, you start losing it. And for most elderly people, that's a health span metric. How healthy are you cognitively? That's why you sometimes see an 80-year-old person who is as sharp, if not sharper, than a 65-year-old. It's a quality metric in terms of how you're living. The second one is physical and structural. As in, when you wake up, how many limitations do you have to conduct activities of daily living? praying, cooking, walking upstairs. Most of the elderly people, that's where a lot of limitations comes into play. And it affects your quality of life, because even if you want to go and see Auntie Satan, you're thinking about, I have to get down the stairs, I have to get dressed, I have to walk to a car. Hey, buy my call card. But things are in the way structurally. And sometimes there's components like arthritis, injuries that you've had. For most men, it's always back pain. Because most of the times they've been sitting down for 30 years in offices. And women, it's knees, elbows. And it shows you, for a significant amount of their life, they've been overusing their knees, their backs, and their elbows. The women in the photos, it's always their knees, backs, and elbows. So for 30 years, what they suffer in their old age are physical and structural hindrances that are based on the life that they lived. But very often do you see men complaining about elbows and knees. If it's knees, they've carried so much body weight on them that too much pressure has been on their knees for a very long time. So there's a Gambian story in every 60-year-old woman that you see. The softness or hardness in their hands, the pain in their joints. So they lose the ability to pray. And the most beautiful thing about prayer for the Muslims in the family, it's the one movement that every joint in your body flexes and relaxes. It's the one movement or activity that if you pray, typically your ankles, your knees, your elbows, your wrists, your fingers, your toes, every joint in your body has at least 5 days where they're stretching. There's a religious component to it. That's why people that practice yoga and meditation, the poses are very similar to the Islamic way of praying. Because they know no matter how sedentary somebody is, if you pray 5 times a day, you've stretched 5 times a day. You've stood up 5 times a day. You've pushed your body weight up 5 times a day. And my dad would tell you, I have a very interesting relationship with how I like to make sense of religious practices from a humanistic standpoint. But prayer is the biggest form of exercise. Meditation, yoga, because you live a healthier life. And going back to the Japanese culture, they have a culture of older people in the morning stretching. They have a culture of walking. They have a culture as the older they get, the less they eat. They change their diet because they know at 24, you need a lot of carbohydrates, but in your old age, you need more protein. Because our muscles, as we get older, you start losing more muscle as an elderly person. So protein is actually more important for you than carbohydrates. Meaning if you're eating a plate, you need rice this size, and your body has enough energy for the rest of the day. But the moment you start losing protein, think about your body as in your bones are surrounded by what? Muscles. It protects the structure. The moment you start losing the foundation around it, you have a higher chance of fractures, of falling down. But in our society, the new yakabem face, you overload your body with carbohydrates, which you don't need, and you're undernourished when it comes to protein. Also something that we don't talk about, how we should evolve our diet as we get older, because your energy requirements are not that big. The last component to health span, I talked about cognitive activities of the mind. And everybody in the room is a wealth of knowledge. I look around the room, all of you guys, books need to be written about your life so that my daughter could have a chance of getting that wisdom. books, but our libraries are flooded with which stories? Not our stories. Cognitive is one. Physical and structural I talked about. The last one is emotional. One of the biggest things that get in the way when it comes to the well-being of seniors is loneliness. Loneliness. Even seniors that struggle with depression or seasonal activity disorder, and for sometimes that could manifest as December, October, November, December, your spirits are high because the grandkids are going to be coming back. And then January, February, you dive into depression. Loneliness affects the livelihood of seniors more than we talk about it. Because the average senior, even if you live in a compound around kids, Assalamu alaikum, and then we're gone. Good afternoon, ma'am. We're back. But you're not having tactile interactions that every human being, we're connected by human experiences. That's why when you even have a deep conversation with somebody, that's a genuine conversation, your brain starts sending the same chemicals to make you feel more connected as a human being. That's why when you hear serotonin, that chemical that brings belonging, everybody in the room right now, we're having serotonin exchange because you're having a meaningful conversation with somebody. Even touch. If you're a widow or a widower, and we don't have a very affectionate culture when it comes to public displays of affection, we have some of our patients where the only time a human being touches them is when our nurses come every single month to check their blood pressure and say, Auntie Jika, how are you doing today? Just this. They haven't had this in sometimes 2 weeks. So the emotional well-being, and that's why a lot of our communities, especially in Gambia, our church communities, our mosque communities, the more engaged you are, our women groups, things like this, every time you leave, you may not be able to describe it, but there's something that is reawakened in you versus days that you stayed at home. Human beings are social animals. Human beings are connected by emotion. That's the one emotion that transcends any culture. Which is why even America, where they have these nursing homes, their retirement homes, they know that the average American professional is so busy, loneliness would kill elderly people before the Four Horsemen. So if they put you in a community when you wake up, you play cards with Auntie Juka, you play chess with my dad, you gossip about your grandkids, share photos, you're controlling the emotional aspect of our well-being that is critical. So I really urge you guys to assess those three components when you leave. Your cognitive stuff. Are you able to do things cognitively that you used to enjoy doing? Are you forgetting a lot? Structurally, what are some of the things that you used to be able to do effortlessly, like just standing up from a chair without holding on to something? Getting into your bathtub without holding on to something? Praying 4 rakas without feeling pain where you have to grimace or adjust your position because your ankles, or for some people, they're sitting down praying. But the last thing is, are you okay? We never ask you guys oftentimes, Papa, are you okay? You just lost a really good friend of yours. And because of our society, once again, our fathers, our uncles are passing away early. So most of you guys, the one social activity that you go to every week is a reminder of death coming. It's funerals. Every day, I papa for them on, I declare them on. When you talk. Yeah, for them on, them on geology. So every day, and these are people, your colleagues, where it's impossible for you to face mortality and on your way home, not think about you. It's impossible. And most of the times you're grieving because these are people that are near and dear, and Gambia is small. So one person passing away, and there's people in our communities, in our circle, that when they pass, scores of families were grieving. To this day, Uncle OJ, may God rest his soul, a lot of families are grieving because people like that and people like you guys, you're our founding fathers as a nation. So if one elder in Africa dies, it's like a library was burned down, but it's like you're in a forest and a giant tree falls down. It creates ripples across our society. So the emotional well-being of our seniors is something that should be at the forefront of providing care, because it's very difficult to have somebody who's older than 65 that doesn't have one thing in those three things that keeps them up at night. Either cognitive, physical or structural, or emotional. So the conversation needs to happen. Organizations like this need to happen. The social groups need to happen. Social engagements that are not funeral related need to happen. Because once again, where I started was you guys are endangered species in our community. 2.5% is not big enough. If nations are able to get 30%, Gambia has an opportunity if the average 16-year-old starts having a different relationship with healthcare at 16. In 50 years, Gambia may be the healthiest country in Africa because we're a small population, but we could have 20-30% of our population who are above 60. I really truly believe that, and it doesn't require building hospitals. You're building hospitals, we don't have enough doctors. There's 10,000 Gambians to one physician. And if you really wanted to check a physician who's completed their complete training to get at a consultant level, it's probably about 30 or 40,000 Gambians, if not more, to one. In some cases, it's 2.5 million Gambians to one. Imagine having a structural problem and needing Dr. Marena. If having a cardiovascular emergency and needing Dr. Jaita. When for 2.5 million people, we have only one cardiologist who's completed training and is choosing Gambia. We have a lot of Gambian healthcare professionals, but because of the nature of our society, it's such a huge sacrifice to come where sometimes it works against your own craft. Because they're calling, you're practicing medicine, you're practicing pharmacy, as in it's a continuous education process. So the moment you graduate, you're not done, you just began the practice. Which from a healthcare standpoint, I always tell people your best safeguard in the Gambia is not needing a hospital. Because no matter how much money you have, even by the time you reach to the hospital that you desire to be in, it may be too late. So if you get an assessment, especially those of us that have chronic conditions, every senior, at least once a month, you need an objective assessment of where your health is. That covers your cardiovascular system, covers your emotional well-being, covers your structural stuff. And then if though medications is a cornerstone of that treatment, you cannot afford to not have access to medication because heart failure, hypertension, diabetes, the condition doesn't kill you, the endpoint kills you. People don't die from hypertension, they die from a stroke, which is the endpoint. Diabetes oftentimes doesn't kill people. You may go into a diabetic coma or you have a foot infection that does not heal, and because it's not healing, you have a higher risk of infection. So medically, we have two options. We either cut the leg to save the body, or save the leg and the infection will take the body. Which is why most people that even resist amputation, most of the times they won't live a year or two longer. The infection killed them. Because the moment the infection gets into your blood and it's sepsis, even the most powerful antibiotic in the world may not be able to save you. But oftentimes, I think as medical professionals, we don't do a good job communicating about healthcare in a way that everybody understands it. We're not good communicators most of the times. Unless you come from a household where communication is a mandatory requirement. But they don't train us to communicate with patients. A lot of you guys have had healthcare experiences, and you were more confused leaving the facility than you were entering the facility. So your sons and daughters ask you, ganyan na naka, and nothing. And because of where you live, we're not leveraging electronic health record systems. There's not a track. The next time something goes wrong, you have to start the entire process. When it was just, your medication is not working the right way, we just need to double the dose, change it from you taking it in the morning to in the evening, check you for a month, it works, we keep you there. That's the only intervention you needed. So it's very essential. I'm going to conclude by providing the 5 pillars to healthcare, especially as senior. And as I mention it, I want you guys to assess how well you would grade yourself or your friends on a scale of even 1 to 10. The number one and one of the most important things, not only for seniors but for human beings, is sleep. It's sleep. Sleep. Our God is a beautiful God, moms and dads. He knew that the human body could only reset and recalibrate itself when he intentionally turns the body off, but keeps the light on. Your digestive system, your cognitive system, your central nervous system. The moment as a senior you start getting less than 7 hours of sleep, you are becoming unhealthier. Quality of sleep is the most important thing for you guys. The moment you start getting less than 7 to 8 hours of sleep, you're headed towards issues. Because the next day you're likely to have more stress in your body, chemicals being dumped in, your blood pressure will go up. You start gaining weight. It starts affecting your memory. Sleep. It should be non-negotiable. Getting 7 to 8 hours of sleep. When we're young, we could get away with it. But that tax bill is always due. And most of us, if you really look, we're barely even sleeping 5 hours a night. It's essential. And that's why even during sleep, what are you doing? You're fasting. Sleep, you're fasting. Because God knows the only way He needs our body to be in a fasting state for at least 7 to 8 hours, for it to repair itself, remove the toxins, digest all the food, process it. That's why fasting, most of the times, once again, if you look at our religion, God implanted certain practices to make sure that more humans are more likely to be adherent to it. But 7 to 8 hours of fasting where all you consume is water is essential for our health. Which is why when you're sleeping, you cannot eat. So sleep is number one. And they tell you the best way to calibrate your sleeping, there's a 3-2-1 method. You stop eating 3 hours before sleep. You stop eating. Your last meal of the day should always be 3 hours before you sleep. You stop drinking 2 hours before you sleep. Because the consequences with the sleep is you're going to have indigestion the next morning. And most of the times, if you wake up with indigestion, just reverse engineer. You didn't observe the 3-hour rule. And certain foods that we consume sometimes needs 5, 6, 7, 8, 9 hours to be fully digested, where our body takes what it needs from it and gets rid of everything else. So 3 hours before sleep, you stop eating. Water consumption and fluids, you stop 2 hours before. Because if not, you're going to start waking up in the middle of the night. It affects you. And then screens 1 hour before you sleep. You shouldn't even have your cell phone around. Anytime you look at a phone screen, a computer, TV is less. But especially with the phone, 1 hour before you sleep, you've disrupted your sleep cycle. Because going back to evolution, guys, when we didn't have clocks, TVs, our body programmed our sleep around what? Daylight. That's why nocturnally, the moment the sun sets, your body starts producing melatonin to get you ready for sleep. And in the morning, even without an alarm, if you sleep in a room that is too much light coming in, which is not good, by the way, your room should be as dark as possible. It wakes up your system. And phone devices, that's the biggest disruptor of sleep. Because oftentimes, we're looking at social media, we're looking at WhatsApp, and your brain that should be shutting down to start repairing is processing things. You may see something that invokes an emotion in you, and your body's dumping stress hormones into your bloodstream, anxiety hormones into your bloodstream, when you should be slowing down. Which is why most people that either pray or read or any activity that doesn't require a screen, 1 hour before bedtime, that's when you start. So 3, 2, 1 when it comes to sleep. 3 hours before sleep, stop eating. 2 hours before sleep, stop drinking. 1 hour before sleep, no screen time. You'll notice how the quality of your sleep will improve. You'll notice how in the morning, you have the right amount of hunger. You're not too hungry, but you're not waking up with indigestion. And you'll be able to sustain a quality sleep that you're not frequently waking up to use the restroom. That's health component number 1. Number 2 is diet. What you eat. We are what we eat. The average Gambian diet has too many carbohydrates, too much sugar, not enough protein, and oftentimes, even if it's green vegetables, you've cooked it in oil, so you've lost all the benefit. So that means you're increasing your risk for hypertension with the sugar, for diabetes with the sugar. You're increasing your risk of hypertension with the amount of salt that we're cooking with. You're increasing the risk of high cholesterol and heart disease with all the oils. So what should be nourishment for our body, which even when we're praying sometimes, you pray to God so that the food may provide nourishment for our bodies, you're doing the reverse. You stop ingesting food, you're ingesting toxins into your body. You're doing harm to your body, which is why a lot of diseases, they used to call it the rich man's disease, gout. Because too much meat causes high uric acid levels, which presents as gout. Diabetes, because most men who are wealthy, big stomachs, which is a sign that there's disease on the way, if not already there, because it blocks circulation. You could narrow it down to food, our relationship with food. Every senior needs to have a nutritionist or somebody who could tell them, Auntie J, now this is the new diet. In the morning, X, Y, and Z. Dinner, you don't need no carbohydrates. You need protein and vegetables. No carbohydrates. Most people need no carbohydrates at night. So ribibana, have it in the morning. Chura gete, you love it, have it for breakfast. Dinner, you don't need all those carbohydrates. Because remember, carbohydrates is fuel. Unless you plan on running a marathon in the middle of the night, why are we consuming all the carbohydrates? And that's why Ramadan, more people get sicker leaving Ramadan than before Ramadan. Because think about what happens. Overconsumption of calories, overconsumption of sugar, lack of movement during the day because you're fasting, and then no sleep. So everything I talked about, just think about the combination, is that it's a toxic elixir. No sleep, overconsumption of calories, too much sugar, you're getting sicker. So if you add somebody who has diabetes or hypertension, even hospital systems will tell you mortality increases the first 2 months after Ramadan. Because people that have diabetes, hypertension, you used to take your medications at 8 a.m. and noon, you now have to find a whole new schedule. As human beings, we're forgetful. So your adherence goes down, your consumption goes up. So diet is essential. And we're blessed with a lot of foods that are natural in the Gambia, that everybody has to reevaluate their relationship with nutrition. It's essential to your health. Even if you are healthy, the diet is a key component. Sleep, 1. Diet, 2. Number 3 is exercise. Movement. And most of you guys, I know you get some level of exercise. But your body needs to exercise to be able to maintain its capacity to handle your body. Your joints need that flexion. To get your strength is important. Most seniors, one of the first things they lose is the ability to hold on to something tightly. Their grip strength. Or when they're getting up from a chair, they lose the ability to use their hands to push their body up, to stand up. So even as exercise, as a senior, if you just sit down and lift your body up, stand up, that's exercise. Because you're using your muscles to maintain yourself. Even if you have something that you think is medium weight that you won't hurt yourself, you pick it up, you put it down. It's an essential component to lives of seniors. Not everybody will be able to exercise in varying degrees. There's some seniors that still have very high activity, but no activity is almost, you can't afford not having activity. It could be walking. It's easier on the joints than running. It could be just lifting something that is a medium-sized weight up above your head. Your grandkids will probably laugh at you like, Mom, what are you doing? Ignore them. Just getting something that you can lift up to your head, bring it down. Lift up to your head, bring it down. Being able to handle your weight. If you have a flight of stairs, walking up a flight of stairs, coming back down slowly. It has to be a staple in everybody's life as a senior. You cannot afford not exercising, not moving the body. So that's component number 3. Number 4, I've already talked about emotional wellness. It's key. One thing about our community is we have support groups. We're a community where nobody has the right to be lonely, because there's always somebody there to talk to. But emotional wellness, hopefully even Auntie J will provide some ideas and solutions to kind of activities that seniors could engage in to gauge where their emotional wellness is, certain things that boost your emotional wellness. We'll provide as much information for people that want to utilize it, even exercise routines. I'll make sure we provide those information of things you could do at home. You don't need to go to the gym. If you live close to the beach, that is also therapeutic. If you're gonna walk on the beach, because just being in nature improves your emotional wellness. So for my aunts who live in Fajada, Bakau, Cape Point, or next to a beach, even if you could do it 3 days a week, you find a partner and you say, we're just gonna go to the beach. We'll walk whenever we feel a little bit tired. We'll stop, face the water, take it in, take deep breaths. The emotional wellness is not cultural. Swing Adabi is beautiful, but it's not perfect. It misses things like emotional wellness. I don't even think you could describe it in Wolof or Mandinka without struggling. It's not in the lexicon. A lot of things that are emotional in nature, if it's a negative emotion, you could describe it. But how do you describe emotional wellness in Wolof? You have to think about it. Huh? Helbudal. Yeah, Helbudal. Why Helbudal is just Helbudal is not even emotional wellness, even though it's a good description. But what I'm saying is we're not used to seeing that as a component of our health, because we associate health with only if something goes wrong and you need somebody with a white coat. But as elders, once again, most elders struggle with loneliness than they do high blood pressure. Because the high blood pressure, the moment you take your medication every single day, scientifically, you're not hypertensive anymore. You're hypertensive when you're not taking the medication. You're diabetic if you're not under control. But emotional wellness, there's so much subjectivity in it, where it's not a pill that you could just give and it takes it away. It's a practice, which is why the fourth component is very important. I made the last component last for a reason, because not everybody needs it, but certain people can't do without it. With this exogenous substances, meaning something that is foreign that you have to put into your body to help fix a problem. Medicine. That's all medications are. Supplements, some of our natural ginger, moringa. There are scientific benefit to these things. As somebody who has studied how they make medications from scratch to every single level in what a medication does in a body, I've studied it. There are scientific benefits to some of our local agents. What is lacking is it's not studied to quantify if it's safe and effective. Anything that you consume that is not natural and is not food is safety and efficacy. Even for a medication to be approved, you have to establish that it is safe first before even effectiveness. So if you hear of clinical trials, they don't care whether or not the medication is going to work. The first thing is it safe? That's why they give it to rats, because if it kills a rat, it's going to kill a human being. Then they may give it to chimpanzees, just establishing safety. Once you know that, okay, this is safe at this dose, which is important. Certain medications, one medication that was safe for you at 30 years old is no longer safe for you at 65 years old. Because every medication that you put in your body has to go through either your kidneys or your liver. That's why those two organs are so important. Every medication known to man, either your kidneys have to remove it or metabolize it, meaning break it down, or your livers, sometimes both. Which is why people that have kidney failure, people that have liver disease, and that's the only reason why even with alcohol, they tell you, alcohol, it starts competing for your liver. So you're over-consuming it, but your liver is being strained. So liver and same thing with your kidneys. Certain medications, kidney is a filtration system, meaning it gets rid of toxins. As you get older, the performance goes down. It's like a lot of things in our body. You can't use the same pipe that God installed once for 100 years and expect the same pressure. That's literally what our body is made of, pipes. Big, small. So as you age, the pipes wear and tear, they lose their elasticity. So that's how you have a lot of issues with blood pressure, with your kidneys not being able to process. So that's why adults getting a kidney function test every single year is extremely important, especially if you're on medications, because it's either going to touch the kidneys or the liver. So when it comes to medications, certain people, once you have a chronic condition, you need medication. Hypertension, the horsemen again, cardiovascular disease, hypertension, diabetes, some people Alzheimer's. Cancer is not as prevalent, but most of the times the mortality is high because you don't have a lot of options. You need medication. So as a senior, if you have a condition that you know is not going away, the quality of the medication and the quality of the delivery is more important than even Johns Hopkins University, than any hospital in the world. If you have a condition that requires you taking medication every single day, having that medication on the side of your bed for you to take it every morning, it's more important than anything else in your health ecosystem. Because the moment that goes away, you're running towards the bottom of the funnel that I talked about. So for hypertension, you're going to have a stroke. For diabetes, your nerves are going to start going bad. Your eyesight is going to start going bad. Your kidneys are going to start shutting down. So diabetes and hypertension, they're like evil cousins. And Gambia has a very high prevalence of kidney disease, but also the mortality rate is even higher. Because on any given day, 25 Gambians cannot receive dialysis at the same time. And that number is even generous. It's less than 25. Meaning we don't have the facility to provide, which all dialysis is your kidneys have stopped working. So what the kidneys used to do, a machine needs to run blood through the machine to remove everything that does not belong in your body. If not, you're gonna die. So the endpoint for all these diseases, we do not even have the infrastructure for 2.5 million people, for 25 people to have an artificial kidney at once. But if you can take one pill every single day, the right diet, you sleep adequately, you take care of your emotional wellness, because there's this substance called cortisol. You guys have probably heard about it. It's a stress hormone. When you're stressed, your body dumps cortisol into your system. Cortisol increases your heart rate, it increases your blood sugar, it increases your blood pressure, because it's the same substance that God created to give us the energy to run away from danger. If a lion is coming, adrenaline, cortisol, a stress hormone is dumped into your system so that you could automatically run faster, jump higher, because your survival depends on it. But most things that used to cause us to need that chemical are no longer around. So anytime you're stressed, your body's dumping cortisol into your system. Healthcare is not that complicated. It's a very difficult thing to solve at a macro level. But if you understand it from a perspective of a progression, you could put a lot of defense mechanisms in place. That way you're less dependent on the emergency care system. You're less dependent on flying to Dakar. You're less dependent on your loved ones in the diaspora having to fly you into a health system. Because most of the times, you could manage your conditions by just constantly knowing where you are. And in conclusion, that is our responsibility as healthcare professionals that are of you guys. We are because you guys are. The healthcare agiremande mo anda. There is no way a non-Gambian could provide healthcare more genuinely than I can. I'm not xenophobic, but the medication I bring in is family. That's my mom. That's my dad. That's my cousin. Even at Innovarx, a lot of you guys have interacted with our staff. They're very young, and sometimes it's very difficult to execute a vision. But my number one job, I keep telling them, is one, ñu leen yaakaar dafa bari. And this is more than just healthcare. This is restoring dignity into the lives of people that look like us. Because deka bi su nehe, everybody is coming. Why su nahare, ñun rek ñoo see des. So on that note, MTJ, I'm honored. As I've told you, not me, my entire institution are committed to being partners when it comes to the welfare of seniors. Some of you guys may be aware, last month we decided it was mind-boggling that we have no senior benefit than as a culture. As a nation, we do a horrible job with repaying debt to our seniors, especially with healthcare. And I believe in collaboration because I'm not the only one who's trying in healthcare. There are a lot of Gambians who are trying in healthcare. But certain things I also don't believe in asking for permission and consensus to do it. That's why we like taking the charge and saying, you know what, any senior that comes to our facility now, you're gonna pay less. Any senior, wherever you live in the Gambia, will deliver products and services to you free of charge because we wanna remove all the barriers to care. And hopefully that will encourage other people to realize that 2.4% of our population, to me, are the most valuable aspect of our society that we have to protect, preserve, and honor. So I honor you guys and thank you so much for the invitation.